Okay, so going into chapter 20 in your NAITH textbook, you will find this on page 283 in your book. We're going to be talking about the evaluation of scientific literature and dental products. The learning objectives for this chapter will be to describe how to evaluate dental care products, defend the dental hygienist's value in advocating the use of effective dental care products and treatment modalities, educate the public in evaluating dental care products, effectively critique dental research reported in dental and lay publications. Lay meaning to the public. All right, so the competencies for this chapter will be that after you read and study, you'll be able to use critical thinking skills and comprehensive problem solving to identify oral health care strategies that promote patient health and wellness. Use evidence-based decision making to evaluate emerging technology and treatment modalities to integrate into patient dental hygiene care plans to achieve high quality, cost-effective care. You'll be able to assume responsibility for professional actions and care based on accepted scientific theories, research, and the accepted standard of care. Integrate accepted scientific theories and research into educational, preventive, and therapeutic oral health services. Evaluate factors that can be used to promote patient adherence to disease prevention or health maintenance strategies. Utilize methods that ensure the health and safety of the patient and the oral health professional in the delivery of care. So, dental hygienists are recognized as advocates in healthcare today because of the valuable information they provide patients concerning dental hygiene treatment philosophies, oral health behavioral education, and dental care products. According to the ADHA, they said that most patients seek advice first and foremost from their dental hygienist regarding dental care products. That means that when patients have questions about either treatment or products or ingredients in dental products, they're going to ask you. You are the person that they want to know your opinion because they understand that you have education in this and that you've learned about the products and that you're exposed to them all of the time. And also because they have more time with you. They've built a rapport with you. And so they trust you and they trust your opinion. What I see a lot is that they when it comes to a patient asking you a question or asking the dentist a question, they will believe the dentist over you, obviously, right? There's a rank structure around there, right? But they don't have time to ask a dentist all of those questions because they're not with the dentist for an hour. They're with you for an hour. The dentist has 5 minutes to get in there, look at their teeth, and get moving. So they have the time to think of the question and ask you, and they're looking to you to have an educated, evidence-based answer. And so it's really important that a hygienist have that background in research to be able to recognize those effective and ineffective dental care products. When you are doing your product presentation, I don't necessarily want you to prove that your product is effective. Your product may not be effective. Your product might be terrible. It might be absolutely horrible. And if you spend 8 minutes telling me how awesome your product is, and I already know that I'm pretty aware of each of the products you guys have chosen. So if I already know the problems with your product, I'm not going to believe you. I need you to critically evaluate your product. You're not their sales rep in this 8 minute presentation. You are a dental hygienist evaluating whether or not you would recommend that product. Okay, so I want the real scoop. I want the real answer. I want you to go at this product skeptic, okay? And I want you to do the research and I want you to find out enough about that product that you can make a very educated recommendation to patients, to the other students in your class, and to me, okay? I want to learn something from you. So, as you all know, dental care products are regulated by the Food and Drug Administration, which is a part of the Department of Health and Human Services, right? The Food and Drug Administration ensures that food, cosmetics, and radiation emitting products are safe and that medicines and medical devices are safe and effective. And so, typically, dental care products fall into medicine and medical devices, although not always. So be careful with that. Although the FDA I'm sorry, without FDA approval, a manufacturer may not legally market a product. That's an important word there. Not that they can't sell their product, but that they can't market their product. If you'll notice, there's not a whole lot of commercials or advertisements for supplements, right? Because most of the time, supplements don't get FDA approval. And so when you take a supplement, like BCAAs, or if you take pre-workout for like exercise kind of stuff, or if you take L-lysine, or you take a lot of vitamins, well, there are some companies who, sell like a multivitamin or something like that. Um, those are typically FDA approved, but not not all of them. So you want to be really careful. There's another thing with probiotics right now. There's not too many probiotics out there that are being approved by the FDA. So just be careful about what you're buying because they may not have gone through this very rigorous process. Also, on that note, there are a lot of products on the market that are not safe for you just because they've been approved by the FDA. And so I want you to be really skeptic when you go at a lot of this research. So just because there's a lobbyist out there who paid, or their research says one thing, that doesn't necessarily mean that's the end all be all for that product, right? We could do another research study today and prove that that product is terrible, which is exactly what happened with triclosan. So triclosan is an antimicrobial ingredient that was found in hospital grade soaps. It was also found in Colgate Total was the big marketer for triclosan. And it's a wonderful product used in the oral cavity because it does absolutely reduce gingivitis. But the problem is that they weren't able to prove whether or not the risk outweighed the benefit of creating superbugs, right? Also, there were some issues in some studies on lab rats where they were starting to get liver tumors of long use of triclosan products. And so the FDA in 2018 ended up banning triclosan. It took Colgate about a year to get rid of that product from their Colgate Total. So now it has stannous fluoride in it. And so the FDA's responsibility is to evaluate these things, right? When that organization sees that there's a problem with an ingredient or there's a problem with a product, then they encourage the company that violates whatever it is to correct the problem or to recall that faulty product from the market. So that's what happened with Colgate. In 2018, they banned triclosan, and then Colgate, it took them about a year and a half to completely reverse all of that stuff. And these days you can't find triclosan toothpaste anymore. So it's been a good thing. If that company cannot or will not correct that problem, they're still marketing the product, or they're still using something that's been banned, then the FDA can bring that legal action against that product. And so it's important, if you know of a company or whatever it is that's doing something wrong, you have to send it to the FDA. The FDA also has an FDA medical bulletin. It publishes monographs concerning therapeutic products. You can find some of the information about triclosan there as well. The FDA approval for drug products is mandated by law. So without FDA, the manufacturer can't legally market. So this figure is 20-1. It's on 284 in your book. It just shows that there is research that comes from different places, and it all feeds into the Food and Drug Administration, who then sets guidelines for the industry that makes products, and that then goes to the practitioners because we can't use products that aren't being made. Obviously, industry has to make them before we can use them. And then the practitioners are the ones who recommend it to the patients, which was the goal in the first place. Okay, so the ADA seal of acceptance. This is it's an interesting topic. So the ADA has a program where they give a seal of acceptance to products. The caveat is that the product has to apply for the seal and it has to pay money to the ADA. It's not cheap. And so they do their application, they send their product in, they send in the studies, the ADA evaluates these products, and then they either, give them a seal or they don't give them a seal. They declare them either them to be safe, effective, and worthy of the ADA seal. It lasts for 3 years, and then the company has to reapply and pay again. It's not mandatory. It's completely voluntary. So companies do not have to do this. And it's a pretty effective public relations campaign for a professional association. You'll find that the ADA seal is actually pretty sought after among a lot of dental companies because it has a little bit of sway for consumers. And so it has guidelines for those testing and the advertising of those products. Does this mean that a product that doesn't have the ADA seal is not safe, that it's not effective? No, absolutely not. So just because a company has decided not to apply and pay the ADA to give it acceptance doesn't mean it's not an awesome product. It just means that they didn't feel like giving the ADA any money. And so you should recommend products or treatment modalities based on documented, evidence based research rather than a product seal because obviously the ADA is being paid money, right? Anytime money is changing hands, you want to be a little skeptical. So just because maybe there's toothbrush manufacturers, I'm sorry, the book says there is an example of toothbrush manufacturers sued the ADA for failing to adequately warn people about the possible dangers of brushing. Specifically, the lawsuit sought damages on behalf of anyone who suffers from toothbrush abrasion. The ADA is not a government entity, but represents the interests of the dental professional. The dental professional consequently must base recommendations on scientific literature. So just because the ADA has approved a product doesn't necessarily make them the perfect product, right? It could be not the best product. There's a pretty classic thing between Oral-B toothbrushes and Sonicare toothbrushes. Oral-B has the ADA seal of acceptance on there and Sonicare doesn't. You'll find that it's one of the big marketing tools for Oral-B. They'll let everybody on the face of the planet know that they have the ADA seal of acceptance and Sonicare does not. And Sonicare is not really concerned about what the Oral-B is doing. They're just doing their own thing over there and they don't care about the ADA seal because they've got evidence-based research that proves that their toothbrushes are daggone effective. So do you absolutely recommend a product just because of it? No. Once again, it comes down to you have to do your own research. So if a product does have the ADA seal of acceptance, it's just one little tick mark in the pros column for that product, right? It means that okay, the ADA looked at them too, but that does not mean you get to stop looking. It doesn't mean that that's the end of your research sort of journey. We also have to keep in mind that the ADA seal of acceptance is from a company that only employs dentists. Okay, that's a dental organization, not dental hygienists. So you do want to keep that in mind that a lot of times dentists have a slightly different view of the world, right? A different worldview, a different perspective than dental hygienists do. So just because, they have that ADA seal, it doesn't mean that we should use that to look at our things. Product and treatment modality should be based on documented evidence, studies, okay? Documented evidence includes the scientific literature and the reported product findings. The seal is not always a reliable gauge for safety or effectiveness. the hygienist has to know how to effectively critique published research in order to make accurate recommendations. Um, I think the most important thing I can tell you is that if someone is trying to sell you something, you cannot believe them. Okay, they can tell you how amazing their product is. They can do whatever, whatever it is. But if they're being paid, if they make money off of you believing them, then you cannot believe them. I'm not saying that what they're saying isn't true. It could very well be true, but you don't believe them. Okay, go around them, see where the money is. Okay, keep the money in mind when you're making these evaluations. Okay, so moving on from all of that, let's say we've got this dental care product, right? It's this new product. We found it. It's on the market, and we're like, what are we going to do with this, right? Um, but where do we go? How do we learn about the product? Well, here's a list of kind of the track that you should follow that could give you a lot of that information. So there is first and foremost sales representatives. They'll be ones who tell you about new products that they have coming out. But remember, we don't always believe our sales representatives, right? Because they make money off of us. So we listen to them, but we have to evaluate those things for ourselves. They might give you clinical reports, right? They'll give you what the studies have shown that they have access to, and that's going to be wonderful for you to be able to look and see, how those studies were conducted. You'll be able to read and learn a little bit more about the ingredients of the product, how the product works, things like that. Those are very important aspects. Then you turn to published peer-reviewed articles, right? So maybe the company is saying that it's this, and the study that they gave you that their company ran said that, but then you go to a peer-reviewed article and you say that, oh, well, there's a little bit more nuance. Somebody else who did a similar study had a completely different finding, right? um, you might also find that dental hygiene schools or dental schools have a lot of places to go, like things to learn about it. And so if you go to a university, if you're going to a university, then there's always a lot of people there who are doing studies. I will eventually try to get a study program off the ground here, but that's going to take a lot of time. And so what you should kind of keep in mind is that one, there's other students in your program who have a lot of knowledge about a lot of different things. And so asking around if you hear of a new product or ask someone else, talking to the faculty, you'll find that a lot of your instructors either know someone or they have already looked up all of that information and they already have a base knowledge. Um, this is a big reason why in your product presentation projects, I want you to talk to me because I have done a lot of research on the products that you guys are looking up. These are big products you guys chose. So, when it comes down to, what you want to write about, I might have ideas of maybe you should write about one thing and maybe not about another aspect of your product because that's not quite as important. So, I want you to talk to each other and to talk to me or talk to other teachers about your products. And then continuing education courses and seminars. These are fantastic ways to learn new things, to learn sorry, about new products. You'll find that there are sometimes um, sponsors for CEs. They'll pay a speaker to talk about their product. And so I want you to be really careful with that. If there's a CE speaker talking to you about a product, they must by law tell you that they are being paid by that product in order to speak to you about it. So if they haven't said that they're being paid, ask them. Okay, at like I know it sounds crazy, but in the middle of your CE, you can raise your hand and say, "Hey, are you making money off of this product, or what? Is there any kind of financial obligation you have to them?" Because sometimes they'll recommend products that are amazing that they're not making money off of. They just think they're amazing, and those are kind of your way to say, "Hey, this is good information." If they're not making money, so keep that in mind. Also, you can go to the internet. Obviously, you want to use caution. We're going to talk a little bit about um, how to evaluate websites. But there's professional organizations, community foundations, or government agencies. Websites are usually a little bit more reliable than those .coms. We're going to talk about the different domains, but we'll get there. PubMed, it says WorldCat. I haven't used WorldCat. I really just love PubMed too much. So, um, you know, use that. So box 20-2, this is on page 285 in your book. This has those sources of information on dental care products, sort of places you can go. So colleagues, other hygienists, other dentists, anyone you know, you can talk to them about what it is. Talk to the sales reps, anyone who works in or around where you work. Those are people you want to talk to. Continuing education courses or professional meetings. This is a great time to talk to people about what they think about certain products, because they have either firsthand knowledge or they know someone who has firsthand knowledge of whatever it is. Now, do you trust them 100% without doing any other research? No, you don't. You're still going to want to read an article or two. Dental hygienists and dental schools, again, this is the same sort of thing. Lay magazines, you'll find that like Access Magazine, and there's a couple of other magazines that have a lot of like marketing in them, that you could read that will have information like this. So those are always good places to go. And then the library, of course, too, is a good place to go if you're looking up information for like products and things like that. We talked a little bit about that in that um, other lecture I gave in research about how to find information on stuff. And keeping and going with that internet, you'll hear a lot of information from your patients. So your patients will come in and say, "Oh, I heard this wonderful thing about such and such, and what do you think about that?" And you're like, what are you talking about? Like, I've never heard of this before." I had one patient come in and I was like, "What kind of toothpaste are you using?" And she goes, "Oh, I'm using this new toothpaste called Mud." And I'm like, "Oh, what's it made of?" And she's like, "Oh yeah, it's literally made out of like clay and mud." And I was, "You're brushing your teeth with dirt?" And she's like, "Yeah, I'm brushing my teeth with dirt." I was like, "Okay, does it have fluoride?" No, of course it doesn't have fluoride. It's mud. Anyway, professional magazines, journals, and newsletters are also good places to go. Talking to sales reps is kind of, hit or miss. And then television, you'll hear a lot of marketing for products on television. I think one of my favorite ones is Parodontax. Parodontax is made by GSK, which you guys actually just had that lecture with Miss Litton. But I have a very love-hate relationship with Sensodyne because of Parodontax and how expensive Parodontax is when it's literally just stannous fluoride. That is the only thing that makes it any different. It's a low abrasive toothpaste. It has stannous fluoride in it. Colgate, not Colgate, Crest Pro Health has had stannous fluoride for years, and everybody was talking all kinds of bad stuff about Crest Pro Health because they had stannous fluoride and they thought stannous fluoride causes stain, which it used to, but it doesn't anymore. We can talk about that later. But anyway, you'll find a lot of marketing on television. Your patients will see marketing on television and they will come ask you questions about it. So you want to have at least a base knowledge of a lot of the different types of stuff that's out there. So if you turn the page to 286, this is box 20-3 in your book. This is questions that you should ask when you are assessing scientific information that you find on the internet. I think I took like a class, it was a part of my master's program, and it was like the base of that entire thing was based on this, how to evaluate scientific literature when you find it on the internet. How do you evaluate sources you read on the internet? Because there is just so much terrible information out there that do our patients know how to read that stuff? No, they read blogs, they read all kinds of stuff. They get their information from Facebook. So they don't know how to evaluate the information they're getting from the internet, and so it's really important that you do know how to evaluate that information. So I also think this is pretty great because if you look down at the bottom of this box, it's written by Beatty CF. This is Dr. Christine Beatty. She is one of the professors at the school where I went. I took 2 classes from her. She was incredibly hard to teach. She was an incredibly hard teacher. She just slaughtered my papers that I would write because she's an absolute grammar, just crazy. And she made me so much better of a writer. I learned things about grammar that I never knew, and I grew up reading, so I just had like an inherent sort of ability to write. And I just sort of had this skill with grammar that I didn't have to try for, right? But for her, she knew all of the grammatical rules and why you could do certain things and why you couldn't do other things. And so I remember the first couple of times I turned in papers to her, here I am thinking I'm going to get, an A on this paper. And I almost always would get an A, but it would always be like a 90 or a 91 because she just completely tore my paper apart for grammar. And it took me a while to figure out that she was very specific on those things. But anyway, I feel like I kind of know a celebrity because here I am teaching a class, and here this information came from her. She did a lot of research and she wrote a lot of things for textbooks. But in this one, we're just talking about what we should be reviewing internet sources for. So the first step is we need to know who is or who are the authors of the material. If there is no author published, right, then that is not a good sign. Um, just because whoever wrote the paper is a doctor, right? Let's say they're an MD, but they're writing a paper on, you know, toothpaste. It's what does that make them an expert on toothpaste? No, it absolutely doesn't. So we want to be mindful that just because someone has a degree or just because someone is, really smart or they have, some letters behind their name doesn't make them the authority figure or an expert in every subject. Okay, so unless that person is, you know, uh, doing research on that topic, they're not. Just because and they're a doctor doesn't mean we can believe everything that comes out of their mouths, right? So which takes us into this next part. What are the author's affiliations, qualifications, and biases? So if we are reading a research article on nutrition and we find out that the person who wrote it works for Tyson Chicken, then, we might not be able to believe that person saying that chicken is the best source of protein, right? We can't believe that because they work for Tyson Chicken. So don't believe things if there's money involved. But we want to know, what is that author's affiliations? Do they work for a university and that's why they're doing research? Or do they work for a company and that's why they're doing research? What are their qualifications? So just because they're an MD doesn't necessarily mean they're the smartest person on earth, right? They're people just like we are. So if they're an MD and they have a certification in um, gosh, um, I've heard of doctors who specialize in like fats and how cholesterol works. And so if you're reading a paper on cholesterol and it's written by a doctor who spent their entire life's work with dealing with cholesterol and medications that deal with cholesterol, then I would believe that person over a doctor who, is a podiatrist. Okay. Um, is the source peer reviewed or edited? So is it peer reviewed is one of the biggest aspects here. Are other experts in that field reviewing this paper? Are they also looking at it? Because if no one else is looking at it, then that means that no one else looked at it, right? Can we believe that person? So just because they have an idea of something or they believe something, if no one else has vetted that information, don't believe it. Is the site authored by an organization, right? So just because, the ADA, right, has this seal of acceptance, so that's a site authored by an organization, right? The things we read on the ADA are probably peer reviewed. They're written by dentists who are probably doing research in that field. But that doesn't necessarily mean that it's the best, right? So like let's say the ADHA writes a paper on cleaning implants, that doesn't necessarily make them experts on implants. So everything they say about implants is probably coming from somewhere else, right? So we just want to keep in mind who's writing it and is whoever wrote it very clear? Because if you can't find who wrote the paper, don't read it. Okay? Don't read the article. It's not worth your time. The author of the paper should be very clear, either an organization that has substance, that has merit, or an author of some kind, okay? Um, just because it's written by an author, right? We want to make sure their affiliations are there too. What is the domain name? So the domain is the dot, three little letters, right? So .gov is written by government agencies. .edu is always written by educational agencies, not agencies, but educational facilities or associations or whatever. .org is an organization. So you'll find that like the ADHA.org, right? Concord.edu, usajobs.gov kind of thing. .net is a network. Typically, .net is kind of in between, right? So their best one is .edu. Second is probably .org. .net is probably just above .com. .com, I think it's for commercial, but it basically means that someone paid for that domain, and you don't have to pay very much, by the way, in order to get a .com, and they can put whatever they want out there. So no one's vetting that information. And then .mil is typically from a military agency, and .gov is also military. Does the author list sources or citations, right? So on a lot of y'all's websites that you're looking up your product information, there is a source listed for where they got that information. I would like to formally invite you to follow that trail that is going to take you on. So click on that source and see where that takes you. And then if that's an article and it has sources, click on those sources and read those. You need to thoroughly look at the information that this site or this website or this advertisement gives you. So if they have sources and citations, it tells us a little bit more that they're being more forthcoming. They're being transparent. They're not just making the information up, right? Because if the source is on there and I can click on the source and go read that, oh yeah, in fact, that source does say the thing that first article said, then that gives it credibility, right? Those citations and those sources give that paper credibility, just like your citations in your paper will give you credibility. Can the information be verified elsewhere? So if I follow that source trail, am I going to find out that the information they said to me is true? This happened last term with one of the juniors. They sent me, some information, and they said that the paper said this, and I was like, oh, okay. So I went to the paper, and yes, it did in fact say that's what it was. But I was like, this just doesn't sit well with me. I don't like what this paper is saying. So I went to the paper and I clicked on its source. And when I went to that next source, the source of the source, um, it said a completely different thing. It actually, the source that my student was citing was not true. And it's well, first of all, it's plagiarism to misrepresent whatever your source is saying, right? So that you can't just make up stuff and then say that another source said it, right? But what that does is it creates a whole trail of misinformation. So even though you're citing something that is true, you're citing it word for word, if they cited something incorrectly, then your information is also wrong. So you wanna fully follow the trail, okay? If I can give you anything, just take that trail all the way back to the studies, all the way back to that primary research that I know you can't wait to go and read, right? Follow the trail all the way through so you can verify it somewhere else, all the way down to a usable source. Does the site reflect a particular bias or worldview? If you can guess how old the author is by the way that they write, not a good thing. If you can guess the gender of your author, that's not a good thing. If you can guess whether they are for or against a product, not a good thing. Okay, whenever you're reading about whatever it is, it should be objective. Okay, if you can hear the bias, or you I guess read, but if you can see the bias written in whatever it is, you may not want to trust that source. You just take it with a grain of salt. They've given you some information, but that's not verified information just yet. Are there obvious errors in spelling or grammar present? So when you're reading a website or you're reading a source, if they haven't spelled something correctly, that tells you that they don't care. They didn't take the time to make it look good, and it tells you that they lack attention to detail. Um, unfortunately, I know we're not English majors, but it's a part of working in literary science. It's a part of being a part of an academic literature, is that you have to use proper spelling and grammar. Why and for whom was this website created? So if the if the website is created for patients very specifically, you might see information that's been kind of interpreted into lay information. Whereas if you go to a website that's clearly been written for a professional, you might see a very different kind of information. So you want to be mindful of that. If I'm going to a website that's supposed to be for professionals, but I mean, this sounds terrible, but it's dumbing down all of the information for me. Well, I don't want that website. I don't want to listen to a sales rep talk to me about things that are too simple, right? Don't give me that this reduces gingivitis. You tell me how this reduces gingivitis. You have to show me the numbers. You have to tell me about where it, breaks the chain. And you have to talk to me about specifics, because I care about the nitty gritty stuff. So you want to be really mindful about who it's written for, and you should be looking up websites and information that are written for professionals, because that is the language that you now speak, and that is the world that you now have to live in. Okay, so get comfortable there. Um, is there advertising on this website? If there is advertising on that website, it means that they're taking money from people or from companies, right? And then companies have a say in what that website can publish, right? Anytime you take money from someone, you owe them. I mean, it seems like it should be no strings attached money, but it almost never is no strings attached. So be careful. Um, when was the website first presented, and when was it last updated? Has it been revised? If you go to the CDC, sometimes you'll run into websites that say, hey, we're no longer updating this information. And that just tells you, okay, this was revised in 2015, and so it hasn't been updated since then, and I'm not going to use this information anymore. Okay, just be careful with that. If the website is under construction, most of the time, you don't want to use that information from a website that's under construction, because if it were a good website, if it were one that had information that was very valuable, they would finish it. They won't leave it undone. So be careful with that. Um, has it been revised? When was the website reviewed by professional organizations? So, if it's a website that's not being written by a professional, and it's not being written from a professional organization, is it being reviewed by professional organization, or how is it being reviewed? If it's not peer reviewed already, where does it get reviewed and who does it? And you want to know all of this information about websites. So sometimes that requires you clicking on the about us kind of link in the website and reading, okay, this website or this product is made by these two dudes who just hated the toothbrushes that they had, so then they went out and made a whole new toothbrush, and now they just these two random joes on the side of the road are just making toothbrushes and selling them, right? But that's probably not information we want. But then they've got a ton of, stuff that looks good. So then we're like, "Oh, I might want to buy this toothbrush." And then we find out who made the toothbrush, and then we're like, "Well, maybe I don't want to buy that toothbrush." So just be careful. Continuing, are the links current, good, and helpful? Are any links dead? So if there's a dead link on a website, it usually tells you that that website is no longer being updated and you don't want to use that website anymore. Is the website comprehensive? So does it explain everything that you needed to know about the whatever it is, right? If it doesn't, and it doesn't have any links to go somewhere else to read more about whatever it is, then it's probably not the end of your research, right? You have to do more. Is the site easy to read? So this one isn't necessarily, something that we have to have, but most of the time professionals will take the time if they're trying to actually give out good information, they'll take the time to, make it look good. They'll give a good color. They'll make it big enough. They'll do all of those things so that people will actually read their research. Okay. Are the site and the material well organized? So if they're, again, spending the time and the money to publish information like this, they're probably going to take the time to organize it well. If it seems unorganized, it's probably not from a very good organization. Okay, so in the evaluation of advertisements, first up in your book, it talks about being aware of what the advertisements imply or promote to our patients. It talks about, how there's a lot of brand placement in movies, and it's important for hygienists to be aware of what those advertisements imply or promote, right? So in a lot of, I don't know if you guys ever have seen it, but there's like some commercials where I'm like, what the heck is happening? Like, what is this? What is this commercial even trying to sell me? And then like all the way at the end, it's like a perfume bottle. Like I just saw everything except a perfume. Like there was like a desert, and then there was a beach, and then it's, by the end you're like, what just happened, right? So advertisements and they certainly mislead patients into doing something else. Like we all hear, sex sells, right? So when we try to sell a dental product, we wouldn't necessarily get someone who needs the dental product. We would get someone whose teeth are perfect already, right? And then we take pictures of them, and then we have them hold our product, and we act like, using our product made them look that way, even though it totally didn't, right? But we still do it because we want to sell our product, and we don't want our product to be sold by people who actually need whatever it is. Anyway, your book talks about like an example of an advertisement that claimed that a mouthwash was the number one choice of hospitals, which is weird because hospitals don't typically have a lot to do with mouthwash, right? So why would that work? Well, for patients, it actually works really well. The advertisement was effective, but it doesn't say anything about the product's effectiveness or the method of its efficacy. It just says that hospitals were picking it. So then we have to take a step back and say, well, why would a hospital choose this mouthwash? Well, I'm sure the hospital looked into whether it was a good mouthwash, right? We kind of trust that, but we can't. What if the hospital only chose that mouthwash because it was cheap? Or what if that mouthwash only chose that hospital only chose that mouthwash because it didn't have any allergens in it, right? Not necessarily because it was a good mouthwash, but because it had things they didn't want, So we have to evaluate what the advertisement's actually saying to us because they're going to be very tricky. My biggest thing with whitening is that they get to say toothpaste is a whitening toothpaste. Its marketing gets to say that. if it has a certain amount of abrasivity in it, which will remove surface stain. So the vast majority of toothpaste out there that you see are not actually whitening toothpaste, but they'll say whitening, but they don't actually whiten your teeth because they just remove surface stain if you brush effectively, right? There's only a handful of toothpastes out there that actually whiten your teeth. So you just have to keep that in mind. Anytime there's marketing involved, they're trying to sell you something. So the branding that's found in magazines, movies, infomercials, and billboards, you want to be really mindful about how are they marketing us this information. And then making information about dental products available to our patients allows them to assess the validity of those manufacturers' claims. So I know Ms. Thompson gave you those like cards and you can like flip it over and see the comparison of all of the different Sensodyne products, right? That's a very similar thing for what I would do in private practice. I would pull out a little card that had all of the toothpastes and kind of pros and cons of each one. And I would say, this is the reason I would recommend this. This is the reason I would recommend this one, and I would talk, you want to have that conversation with your patients and say, what kind of toothpaste are you currently using? What kind of issues am I seeing in their mouth? And then what do they want? We need to bring all of that together so that I could say, hey, you have a lot of wear on your teeth. You need to use a toothpaste that's not abrasive, right? So I'm going to get you away from using Crest 3D White because it's actually one of the most abrasive toothpastes out there. And then I would say, are your teeth sensitive? Well, do I need to recommend a toothpaste with sensitivity? Well, they like Crest, so I'm not going to give them Sensodyne after they've been using Crest 3D White because you should know that there are, the next part is that you should be very familiar with common ingredients, right? So one of the most common ingredients in toothpastes is that it has SLS or sodium lauryl sulfate. It is a foaming agent. It's considered a detergent, right? So when a toothpaste has SLS in it, it's going to foam really nicely in the patient's mouth. They brush, they get that nice sort of scrubby feeling, right? And so a patient who's using Crest 3D White, which is not only abrasive, but also has SLS in it, and then you hand them plain Sensodyne and they brush their teeth with that one time and they chuck it in the garbage because they absolutely hate it because it doesn't have any SLS in it and because it's not abrasive. So they brush their teeth with that Sensodyne and they feel like they didn't do nothing. And you need to be aware of this because you can't give that patient Sensodyne after they've been using the other toothpaste all this time and they love that other toothpaste. They hate the toothpaste that you gave them and they won't use it. So either you need to give them a toothpaste that is similar to what they're already using, but that isn't going to cause the problems, or you need to give them a toothpaste or you need to talk to them about the differences that they're going to find. I talk to my patients all the time. If I give them a Sensodyne product, I say, hey, you're going to hate this product. It's not going to foam. It's going to feel very flat in your mouth. It's going to feel like it's not working very well. But trust me, it is. Give it 2 weeks before you do anything else. And so you really want to have that conversation with your patients. And it's important that you understand those ingredients that are in those products so that you're able to compare and contrast with what they have. Okay. Um, I would really recommend just don't worry about table 20-2, right? Forget about that one. But that 20-1 about the abrasivities, water, humectants, understanding how toothpaste is made, because a lot of your patients will ask you questions about toothpaste, is going to be really important. So I would really look at that. But this is for real life things, not boards. So here's that. Abrasives make up 20 to 40%. Sensodyne has one of the lowest abrasivities out there. You'll find Arm& Hammer also is really low because they use baking soda instead of traditional abrasives. So it's actually also really low. It's very effective, but it's not very abrasive. Water makes up 20 to 40%. You'll find in products that have stannous fluoride, they actually don't have as much water because water will cause ionization, not ionization, but the you know what I'm talking about, where something rusts, it stains. Anyway, that's what happens with stannous fluoride. So stannous fluoride is actually being bonded to something else, and the toothpaste doesn't have water in it, because when it comes in contact with water, just like iron comes in contact with water, which makes our cars rust, right? Doesn't really happen down here in the South, but up north it happens all the time. Everybody's car rusts. Humectants are things that make it wet feeling, right? Foaming agent is like SLS. Binding agents are things, they're binding to the stannous fluoride. There's flavoring agents, which are pretty important to people. I don't recommend ever telling a patient who's using Crest to switch to Colgate, and I don't recommend Colgate back to Crest, because once you find whichever mint you like better, that's the one you're going to stay with. I don't know about y'all, but I like Crest, so I like that sharper sort of spearminty kind of mint. I don't like the more like pepperminty mint of Colgate. But anyway, sweetening agent, very important to some people. I think it's important that toothpaste tastes good. I don't know why anybody would want to use toothpaste that tastes terrible. I don't understand that one. So that's a factor for me choosing a toothpaste, and you might find a lot of your patients feel the same way. Therapeutic agent is always going to be the active ingredient, right? So the sodium fluoride, or uh, sodium monofluorophosphate, or whatever it is, stannous fluoride, wonderful stuff. Coloring or preservatives is usually less than 1% of toothpaste. This just makes it look nice. I don't know about you guys. I always was really amazed at the toothpaste when you would squeeze it and it would come out with like the little strips of different toothpastes. I don't know how they do that. And to this day, I'm still like amazed at those kinds of things. So this table 20-2 is actually some agents that are added to chewing gums. This is not something that I have really gotten into that much, but they add certain agents to gum that helps with, certain oral conditions. And so, if you can see here, Trident Advantage, they've added casein phosphopeptide amorous calcium phosphate. Calcium phosphate is one of the main ingredients in that remineralization of teeth. It's very important. So by adding that to gum, they are certainly helping out with something like that. Chlorhexidine is obviously an antimicrobial agent, which helps to prevent plaque and gingivitis. I am not a big proponent of putting aspirin in gum. Um, I don't know that this is something that they do as much anymore. To relieve pain would be the reason for doing it. However, aspirin is not absorbed through the tissue. It's more so only absorbed in the uh, digestive tract. And so you guys have all seen what an aspirin burn looks like, I'm sure. If you haven't, I want you to Google that right now, because you're going to want to know what that looks like. It looks like somebody put this perfect little aspirin tablet against their tissue. Sometimes people will put an aspirin against a tooth inside their mouth and like hold it in between their tooth and their cheek um, in that vestibule, and it's terrible for you. Not only does it not work because it doesn't get absorbed that way, but it also will severely irritate the tissue, and it causes just this like it looks like the tissue is really blanched, but it just leaches all the color right out of that tissue. So I don't know why they would do this, but maybe I'm just unaware of that. Caffeine, I think I put caffeine in everything. I think that's a great idea. As far as neutralizing stomach acid with calcium carbonate, this is not usually a good idea. You don't want to neutralize your stomach acid. If you guys you might have learned about it in nutrition, but your stomach acid is very important. It's important that it stays acidic. So if you're someone who drinks a ton of alkaline water, or you just drink a crazy amount of water really quickly, maybe you're, drinking like a gallon of water a day, but you drink, 3/4 of it in about 2 hours time frame, you're going to dilute your stomach acid. And your stomach acid is an important aspect of killing bacteria before it reaches your digestive tract. And so if you don't kill the bacteria and it goes on through to your digestive tract, while yes, your digestive tract does have a lot of bacteria already, that's why people take probiotics. You're not necessarily going to want that. You can actually get an infection in your digestive tract. It's called SIBO. Um, and it's something that people who have been drinking a lot of alkaline water end up with. So here's some more of those. My big thing is xylitol here. So xylitol is it's a sugar alcohol and it prevents cavities, and you find it in Trident. BreathRx and Theragun are also carrying it now, but Trident is the one that has it, and Trident has an ADA, man, it's hard to write with this thing, ADA seal. Okay, so next up, we're going to start talking about how to evaluate scientific literature. We're going to talk about how to understand the inherent quality of a well-written study. We're going to talk about each part of studies, and we really should gear our practice toward being based on causation and control of evidence, rather than you know, other factors like money and marketing and things like that we don't want to base our practice on. Okay, so we're going to talk about each one of these: the abstract, the introduction, literature review, methodology, results and discussion, and conclusion and recommendations. So here we go. Okay, so before you turn the page to get to this table right here, right? This table is on 288, but I want you to turn back to 287. All the way down at the bottom in this little green box, it says, "Did you know?" It says, "When abstracting the key concepts from a published study, it is necessary to identify its purpose, the problem investigated, the methodology, materials, and equipment used, the results obtained, and the conclusions drawn." Now, yes, I know it has a couple of different things in here, but basically, this is telling you to evaluate PICO. Okay, this is PICO, except for the fact that it also goes into materials and equipment used, right? Materials would probably be in your intervention. Equipment used might also be a part of your intervention. Purpose or problem are definitely your P there. Um, Methodology is your intervention or your control, depending on what it is. The results obtained is going to be your O. So even though this is written differently and even though it doesn't say PICO, this is PICO. Okay. Okay. So turn the page to 288, table 20-3, levels of evidence. Here we're just reviewing that information I know you learned last term, that there are levels of evidence, and based on the level here is things that this is where we want to evaluate, is this a good research study or is there something better, right? So level 1 is systematic reviews, meta-analysis, and randomized controlled trials. Randomized controlled trials would be um, the best one if there's not more than one study already done, right? Obviously, you have to have more than one study in order to do a systematic review or a meta-analysis. Next up is case control studies, then case series. Case series only study one thing, right? They don't compare it to a control, so it's not as good. Traditional narrative reviews, which have no critical appraisal, these are anecdotal typically. They're like case selection kind of thing. And then 5 are studies that don't involve human subjects. These are studies that are done in vitro meaning done in a petri dish. So they're not on people. But I mean, they're still good studies. So they're still worth reading. They're still worth looking at. But obviously, if you can find a better study on your topic, go read the better study. Okay, so before we get into each of the topics, we're going to talk about the guidelines that you would have to use in order to submit your research, your original research, to the Journal of Dental Hygiene. Um, and this is how that works. So you have an idea for a study. Maybe you're at a school or you're wherever, and you submit it to an IRB. The IRB, the Institutional Review Board, approves your study and you conduct it, right? Everything is great. You get all tons of crazy, wonderful data. You're very happy. Everything worked out great. You write this paper. It is a killer paper. I mean, just the best grammatically ever paper you ever wrote. And you're ready to go. You're like, awesome. Now what? How do I get this information, which is so crucial to the world of dental hygiene? And dental hygienists everywhere are going to just completely turn on their head at these findings, right? How do you do that, right? Well, you're going to remember these things I'm telling you right now. So you're going to submit your paper to the Journal of Dental Hygiene, typically. Now, there are other journals that you could submit your paper to for publication. However, the Journal of Dental Hygiene is kind of like the go-to for dental hygiene. I know, crazy. So here are their guidelines for them accepting your paper and publishing it. Now, when you have your paper, you don't go get it peer reviewed. You just write it and it's wonderful. And then you submit it to a journal and they peer review it. Okay, so you don't have to worry about that. Basically, you need to make sure that the reports are of basic clinical and applied studies that provide new information, applications, or theoretical developments. Typically include the abstract, introduction, review of the literature, methods and materials, results, discussion and summary, or conclusion. An abstract, you have to write an abstract. It has approximately 250 words. It's going to use the headings purpose, methods, results, and conclusion. Although there's a couple of different variations there that you can use for that, but don't go over 250 words. And you're gonna need to give an overview of what your paper was about. So if you're writing a paper, as I know you all might, right? If you're writing a paper that has an abstract, which you won't have to do in my class, then you're going to write the paper first, then go back and write your abstract. Abstracts are written last. The introduction, you don't do a header always for an introduction. That's APA. You briefly orient the reader to the given subject with an overview of the research problem, studied with enough detail to ensure clarity. This is word for word from your book. The review of the literature is to cite a variety of relevant current studies. You compare their findings, clearly indicate all sources of concepts and data. When the source is quoted, you use quotation marks. You guys all know this. You basically you have to state the literature that already exists on your topic for review so that the people know you know what you're supposed to do, right? You're going to define the variables, the hypotheses, or research objectives, and how this study relates to previous research. This is important, okay? It's important that you say what the research was, and then you say how your research compares. Methods and materials. So you're going to describe the research instruments, equipment, procedures, method of data analysis. So you're going to say, we did the study. It was conducted like this. First we did this, then we did this, then we did this. We used this and this and this. Here's an example of that. We did this and this and this and this and this. That you have to do all of that, right? Results, basically you're going to have tables and charts. You're going to say, here's all the data we collected. Here it is this way. Now let's look at it from a different angle based on this. First we compare all of their age ranges, and now we compare them based on their sex, and now we compare them based on their, happiness level or whatever it was, right? Whatever you were studying, you're going to break all that data down into tables and charts, and you're going to put all that information out there, and you're going to talk about the results, right? You're not going to talk about what you infer from the results. You're just going to put the results on there. In the discussion, you talk about the results, right? You talk about how those results, what they mean to you. You're going to evaluate and interpret those findings. You compare them with the other studies. Sorry, that was terrible. Excuse me. Discuss study limitations. Study limitations, right? You're going to say things like, we made certain assumptions because you have to in every study, right? You're going to say like, we wanted to study this, but that's impossible, or we couldn't, or for whatever reason, we didn't do whatever it was. You need to talk about that. You need to say, we wanted to get this kind of findings, but we think that we didn't quite hit the mark and more research is needed, okay? Conclusion, here you're gonna state your conclusion. I know, crazy. Theories or implications that may be drawn from the study, discuss how they relate to the dental hygiene practice, profession, education, and research. Include overall health promotion and disease prevention, clinical and primary care for individuals and groups, and basic applied science. Phew. So we're going to leave that box and we're going to go to box 20-5, still before we start talking about each of the aspects of the studies, right? So in box 20-5, it's at the top of the page, next to levels of evidence, we have questions to ask when judging a research report. I know you guys all know this, but when? When was the work published? It needs to be less than 5 years old, right? In order for it to be current. Where was it published, right? So was it published in the Journal of Dental Hygiene or was it published in Access Magazine? Okay. Access Magazine, by the way, is the magazine that the American Dental Hygienists Association publishes, just in case. Are the author's qualifications appropriate? Qualifications. Are they appropriate? So, is that person, should they even be writing about this, right? Is the purpose clearly stated? Is the experimental design clearly described, right? Could you read it? Maybe it might be complicated to read, like how they interpreted the data, but you should be able to understand how they conducted their study, okay? So while, you might not be able to understand the kinds of indices or, the t-test and all of the formulas that they use to input the data into like a statistical analysis, you should still be able to understand how they conducted the research, how they conducted the study. Have the possible influences on the findings been identified and controls instituted? So, did they find what they were supposed to find and did they properly use their controls? Has the sample been appropriately selected, right? This is important because if they didn't get an appropriate sample for whatever it is, they may not be able to then carry that research on, right? So if my sample is 3 people who are all DH students, right? And I'm saying that whatever I learned from these 3 DH students then transfers over to, every college student ever, right? Is that a good example? Is that a good sample? No, it's a terrible sample, right? Because these 3 DH students might be brushing and flossing every day, and I have students who don't brush the entire time they're in college. That would be a terrible sample for every college student ever. So be aware of what kind of sample the study is using. So, has the reliability of the scoring been assessed? So, did the study actually study what it was supposed to study? Did it actually use the appropriate method for measuring? Is the experimental therapy compared appropriately to the control therapy, right? So did they do everything exactly the same? Was it double blind? Was it single blind? Was it not blinded at all? Did everybody know who was getting what kind of thing? Was it a crossover study? You have to evaluate these kinds of things because sometimes study participants mess up your study and they know that you're studying oral hygiene and they know that they're in the control group, but I'll be darned if they don't brush and floss better than they ever have before. And then you've got them skewing your dang data. So you really have to be aware of these kinds of things. Is the investigation of sufficient duration? This one is the one I run into a lot. I did a study on triclosan, which is why I know so much about it. And I found that there was not a study that was more than 10 years old. And I realized that triclosan's been on the market for 20, 30 years now, and it's not being studied for long periods of time. And yet in lab rats, it was causing liver tumors, but we're not studying people using triclosan for the same amount of time. I don't understand it. So your studies need to be long enough that they provide you accurate information for longevity, right? Is the statistical analysis appropriate to answer the research questions or hypothesis? So is the data that they collected, does that actually answer their question, right? Because I mean, it might be wonderful data, it might give them a lot of information, but does it actually answer the question? I mean, you have to go back to that thesis statement, which is in their introduction, right? The last sentence of their introduction is always their thesis. You have to go back to it and say, did they answer this specific question, or did they just compile a lot of information? Um, have the research questions or hypotheses been answered, right? That's the same thing as this. Do the interpretations and conclusion logically follow the experimental findings? So they, have data and they make claims based on the data, and they say, we did or we didn't prove our hypotheses, but does it? Just because they said it does doesn't mean it did, right? Just you can't just trust them blindly. So, I mean, they're trying to publish papers, okay? But you're trying to find out, should I recommend this to my patient or my mom that should use this product? You don't necessarily want to give that to someone, a loved one, just because someone wrote a paper about it. So be really critical of studies. Okay, abstract. We're finally there. So you're going to have to turn back to page. Oh, wait, hold on. Never mind. Abstract starts on page 289. Somehow we're skipping the title. So titles are important because they should accurately describe the purpose of a study. And that's important. Okay, so make sure you're very particular if you ever write a study about the title of that study, and the title should tell you a lot about what it is. And moving on to the abstract. So the abstract is the section of a study that condenses the purpose of the study, previous findings and methodology, and results of the discussion into one page or less. Typically, it's 250 words. The report recommendations of future studies. So they'll say, this was a pilot study. Pilot study always means it's like a tiny version of a study they're going to do later. A pilot, it sounds like a pilot um, episode, right, of a show, right? They have like the pilot, and that they like test things out, right? They just see how it goes, see how people react to it, and then based on the information they gather from the pilot study, they can then go on to a big study. But they're not going to fund a huge, you know, $1 million study without having already a little tiny bit of information. So that's how that works. But anyway, they often give recommendations for future studies, and it gives an overview of the entire project. Introduction needs to provide a clear, concise purpose statement for the research study. The last sentence of every introduction needs to be your thesis. You guys hate this word, I bet. This is not an English class, but you're never getting away from this word. It's a very important component of the study. The thesis, also, you can write hypothesis. Literature review. So provides a brief, detailed outline of the previous research. Clinical care standards, landmark studies, and commentaries that impact the study. So previous research needs to be current, right? Landmark studies don't really need to be current. So, it could have come out that there was this huge, groundbreaking, absolutely blew everybody's mind study that came out in 1985, right? This happens a lot more in other things besides medical stuff, because medical stuff is usually really always kind of constantly changing. But like if we were to talk about social sort of science, the social cognitive theory came out in like 1985 or 1980 something, and it was by Albert Bandura. So he wrote this study then. And if you're writing a research study about something that has to do with the social cognitive theory, you're going to include the social cognitive theory, which means you got to include something that's more than that old. So if in your studies, there's like this huge landmark study that came out that you absolutely have to refer to because it just changed the world, then by all means include it, okay? Must have current information. We just talked about that. Landmark studies assist in explaining a phenomenon and provide historical context for a disease or treatment. Man, I was like talking up here and I didn't even read this. Information should be from reputable journals. Methodology describes the methods and materials used for the study. Pretty straightforward, right? Has to have a sample selection, it has to be a sample size. The sample size has to be the right size, right? Ethical considerations, right? The IRB will typically do this, but you know, just think about it. It has to have a research design, so it has to tell you how the research was conducted, the product usage, the quality of the examiners, right? All of the examiners are, registered dental hygienists or whoever, and the statistical significance. So that P is greater than or equal to 0.05. There it is. Never going away. Results and discussions includes the findings of the study and a discussion regarding the study. I'm sorry, I said greater than. It should have been less than or equal to, right? Because P is supposed to be less than. Anyway, compares the findings with those of other related studies. So here we compare and contrast, right? Is our study supporting other research or is it contrasting other research? Discusses implications for dental hygiene practice, education, and research. So this is important. Does it say that we should do things differently based on their study? They should talk about that. If their study is saying, "Hey, everything we've been doing as dental hygienists is wrong," they should say that, recommendations or plans for future studies and then can be published in peer-reviewed publications. So here are some peer-reviewed publications. First up is the Journal of Dental Hygiene, wonderful journal. The International Journal of Dental Hygiene, which is the International Journal of Evidence-Based Practice for the Dental Hygienist. This is like a part of this big journal. Dimensions of Dental Hygiene. You guys can subscribe to this right now because of COVID. They're not sending out like the actual magazines anymore, which I love these things. They have a couple of CE in them every time. They're just wonderful magazines. So you guys can subscribe as registered dental hygienists. You get them for free. So you better subscribe. The dental health magazine, or journal, not magazine. Canadian Journal of Dental Health, and then the Journal of Oral Hygiene and Health. These are dental hygiene specific journals. Conclusion. So the conclusion should state the conclusion of the study, right? What happened to it, and address implications. Implications mean, what does this mean now? What should we do going forward? Discuss theories that relate to dental hygiene practice, the profession, education, and research, and they should suggest recommendations for further studies. I think my daughter is moving furniture around, so you might hear some stuff in the background. Okay, so in summary, first, you have to be able to understand and evaluate reports and educate consumers regarding dental care products. So first up, you need to be able to understand research. You need to be able to find it, read it, and understand it. And you need to be able to evaluate it in order to educate. Okay, understand, evaluate, educate. That is the goal here. It's really important that when you are looking up information about a company or a product or an ingredient, especially when you guys are doing that for my class, you're not trying to prove that the product is great. Okay, that was the company's job. That's not your job. Your job is to critically evaluate that product and tell me what you find. Tell us what you find. You are trying to educate us and help us, your fellow students and me, and you basically, to determine whether we should recommend this product to our patients or not. Okay, and I want you to dig deep on these products. I want you to really, really give them a hard time. Okay, because if they haven't proven beyond a shadow of a doubt that their product is awesome, I want you to call them out on it. Okay, I want you to strip away all of that advertisement marketing BS. I want you to get rid of that. And I want you to get down to the nitty gritty of whether they have shown that the things that they said are actually true. Does it really work? Or is it just marketing? Is it just trying to lead us astray and to buy their product and try it out and have all these hopes, right? But they don't actually work. So I want you to really be critical of the product, okay? You are not their sales rep. You are potentially giving this product to your mother, okay? And is the things that that product or that marketing or that company saying, would you repeat that to your mom, right? Would you give this to someone you love and would you let them use it based on the information that you find? Okay? So that is what I want from you when you're doing these projects.